Good morning. So over the last 2 weeks, 164,000 Victorians came forward to get tested across all of our state, and I'm deeply grateful to them. That's the same, it's equivalent of 1 in 40 of all of our citizens coming forward to get tested over that 2-week period. And there are now over 217 places across the state where you can come forward and get tested. Each one of those tests is gold. Those tests are so important to tell us where the virus is at and how it's moving around our community and how we get these case numbers down. And for every single test we did in the metro area, for every single positive case we found, 387 tests came back negative. For every positive case we found in regional Victoria over the last 2 weeks, 2,500 tests were negative. And yet we say again, it is so important for us to have anybody with the slightest symptoms to come forward and get tested as early as possible. Do not wait a day. Do not wait to see if it goes into a different direction. If you've got a sore throat, a runny nose, if you think it's hay fever, if you think it's a cold, come forward and get tested. That's what we're there to do, so we can beat this thing together. I'm particularly a focus for regional Victorians, and it's fantastic that we only have 9 cases currently across regional Victoria. But I am concerned about testing levels across outer regional Victoria. I know that we're all keen to be beyond this, but again, I say, please come forward if you have any remote symptoms. To help with that, we've now expanded our wastewater operations. So we now have 23 sampling sites across regional Victoria, where we're at least weekly, if not twice weekly, testing wastewater to see if there's any marginal traces of the coronavirus in those trace waters. I'm pleased to say we've now got new sites set up at Mildura, at Swan Hill, Wangaratta, Wodonga and Benalla, and we start at Castlemaine this week. So those sites will be an additional way for us to get a sense if there's anybody moving around the community with any trace of coronavirus, but it's a belt and braces approach. We cannot rely upon this to find the coronavirus, but it will help us tell us where in particular we need to look and search more closely. So I say to get to regional Victorians, we'll do everything we possibly can to find coronavirus across regional Victoria, but please come forward. Do not assume that this has passed us. Please come forward to get tested if you have any remote symptoms. Across the metro area, as the Premier has said, we've been focusing a lot over the last 2 or 3 weeks on the outbreak in the outer southeast. I'm absolutely delighted to say that we've had over 16,000 people coming forward to get tested around the wider Casey and Dandenong outbreak. It's a fantastic result from the community, an over 50% increase in the space of 1 week in the total number of people coming forward to get tested. And as a result, we've been able to get to the grips with that outbreak of 44 cases across 8 different households really quickly. It hasn't spread beyond those households. I'm hugely grateful to the people who've been asked to self-isolate for the last couple of weeks while we've been doing this work, and for everybody who's come forward to get tested. And it shows that the community response to this is so important. People coming forward early on help us identify where the virus is. People coming forward in support of that ensures we put a wrap around this, we contain it, and it doesn't spread out much more widely. So it's a very important part of this battle that we will have to fight together. We're continuing to see a lot of work in Wyndham, Hume and Moreland, Brimbank and Hobson's Bay. Again, we're seeing more people coming forward to get tested there in the past week. Again, that's very positive work. We're still seeing some cases in those communities. And again, I particularly encourage people in the north and west, if you have any remote symptoms, please come forward and get tested. We're very active in your areas and working very closely with community groups and councils in those areas. And my thanks again to the regional contact tracing teams, my thanks to local councils, and my thanks to local community leaders for the really passionate and positive work you've done to help us bring people forward. Finally, we've also continued to develop our different ways of testing, and a very important trial we've now concluded with Victoria Police using saliva to test for trace of coronavirus. We know that, that they're using the nasal swabs, although it's a very accurate way of finding the virus. We're continuing to look for other ways of testing which may be quicker, which may be easier, particularly in workplaces and in complex settings. And we've now tested over 1,000 police staff across Bendigo, Spencer Street Station and Dandenong Police Station as a part of a rapid surveillance to see whether there was any level of the virus circulating in those areas. As a result of that saliva trial, we found 1 positive case at Dandenong Police Station. That test has been confirmed. We've undertaken the full close contact tracing and isolation of those individuals. So it shows again the importance of ongoing development of testing, and we will have more to say during the course of the week, as the Premier said, on how we continue to evolve and adapt our approach. But for now, again, I'd like to reiterate, we have seen a fantastic response from the Victorian community. We've seen a fantastic response to come forward and to get tested. I'd ask you again, in order to us to sustain these numbers down, in order to be confident that we're beating this thing, we need to sustain our high testing levels. We need to ensure that at least 1 in 40 Victorians comes forward to get tested, and we carry on in that vein. Thank you very much indeed.